Good morning to all. Myself, Jincy, lecturer from Emmanuel Archer College of Pharmacy. Today we are discussing about the topic prescription. A prescription is a legal document or order written by a qualified healthcare professional for diagnosis, prevention, or treatment of a specific patient's disease. Is written by a licensed practitioner is written as part of a proper physician patient relationship, is a legal document, prima facie evidence in a court of law. The definition literally, a recipe means simply take, and when a medical practitioner writes a prescription beginning with RX, he or she is completing the command. It is probably originally directed at the pharmacist who needed to take a certain amount of each ingredient to compound the medicine rather than at a patient who must take or consume it. Types of prescription forms: private prescription form, National Health Service prescription form. First one is private prescription form. Private prescription form. This type of prescription is generally written on a form that includes name, address, and qualification of prescriber. RX is written to indicate this is a prescription form. This is issued by private prescribers. Then National Health Service prescription form. It is only issued for NHS patients, that is, patients suffering from certain disease, and is issued by government prescribers. Then parts of prescription: date, patient information, subscription, superscription, inscription, signature lines, signature, degree, brand name indication, prescriber information, DEA, which means Drug Enforcement Administration if required, refills, warnings or label. The first one is date. All prescriptions expire after 1 year. In case of narcotics and other habit forming drugs, the date prevents the misuse of the drugs by the patient. It helps a pharmacist to know when the medicine were last dispensed if the prescription is brought for redispensing. Patient information: name, address, age, weight optional but useful especially in pediatrics. Time used only with inpatient medication orders. These are included. Then superscription, represented by symbol RX, traditional symbol for prescription which is always written before writing prescription. This is derived from Latin word recip, which means to take, or instruction given to a pharmacist as well as patient to take the medicine as prescribed. Another theory proposed by some scholars is that it derives from the symbol for the god Jupiter. The connection to healing was via prayers that a specific treatment would be effective and the individual would get better. Then inscription. This is the main body of prescription, which includes the name and quality of medicine which are prescribed. This is written in English language. All medicines are written in separate line along with their required quantity needed to treat the disease. What is the pharmacist to take off the shelf? Drug name, dose, which means quantity of drug per dose form, the physical entity needed, that is tablet, suspension, and capsule. Simple versus compound prescriptions, manufactured versus compounded prescriptions. Clarity of number forms: 0.2, 20, not 2.0. Zeros lead but do not follow. Then subscription. These are instructions given to the pharmacist for dispensing the number of doses to the patient and how the medicine has been taken before meal or after meal. What is the pharmacist to do with the ingredients? quantity to be dispensed determines amount in bottle. For controlled substances, write in numbers and letters. That is 24. 24. Any special compounding instructions. Then sixth one is signature or transcription. Sig, which means write or let it to be labeled. Instructions for the patient. Instructions for the patient. Route of administration, oral, nasally, rectal, etc. Take by mouth, gives you, swallow whole, etc. Number of dosage units per dose. Take on tablet, give 2 teaspoonful, etc. Then frequency of dosing every 6 hours and once a day. The duration of dosing for 7 days until gone if needed for pain. Purpose of medication for pain, for asthma, for headache, etc. Very important to include to purpose as this reduces errors as directed by physician. Special instructions, shake well, refrigerate, etc. Then warnings. And seventh one is refills or renewal instruction. Indicate either no refills or the number of refills you want. Determines maximum duration of therapy. Then signature, address and registration of prescriber. This makes the prescription a legal document. Signature, prescriber registration number is necessary especially in case of habit forming drugs. Prescriber must write brand necessary and brand medically necessary or DA, which means dispense as written, to get non generics. Then model format is included. Then handling of prescription. Then handling of prescription. The following procedures should be adopted by the pharmacist while handling the prescription for compounding and dispensing. First one is receiving, then reading and checking, collecting and weighing the materials, compounding, labeling and packaging. Then receiving. Receiving. The prescription should be received by the pharmacist himself or herself. While receiving a prescription from a patient, a pharmacist should not change his or her facial. While receiving a prescription from a patient, a pharmacist should not change his or her facial expression that gives an impression to a patient that he or she is confused or surprised after seeing the prescription. Then reading and checking. Reading the prescription and checking for legality, legibility, completeness, and correctness. Legality. A prescription is legal when it is written by RMP, registered medical practitioner, signed by the registered medical practitioner. It has all the information required to be contained with respect to parts of prescription. Legibility. Legibility is a problem requiring alertness and on the parts of critical judgment on the parts of pharmacist. Careless handwriting and similarity in spelling of names of different drugs add to the difficulty. For example, prednisone and prednisolone, digoxin and digitoxin. When handwriting is illegible, the best thing to do this is contact the physician over the phone and confirm. Completeness and correctness. The prescription serves as a vehicle for communication from the licensed practitioner to the pharmacist about the pharmaceutical care of the patient. Details to be checked are physician's details, physician's details, patient's details, and product details. Checking the product details will include checking name of the product, dosage form, strength or potency of the medicine, total amount to be dispensed, and its availability, dosage, and directions for use, frequency of administration, collecting and weighing the material. Before compounding a prescription, all the materials required for it should be collected from the shelves or dryers and kept in the left hand side of the balance. After measuring, each material should be kept on the right hand side of the balance. After compounding the prescription, the materials are replaced back to the shelves or dryers where from they were collected. While compounding, the label of every container of material should be checked thrice in the following manner. When collected from the shelves or dryer, when the materials are measured, when the containers are replaced back to the shelves or dryers, then compounding, labeling, and packaging. Only the prescription should be compounded at a time. Only one prescription should be compounded at a time. Compounding should be done on a clean table. All equipments required should be cleaned and dried. The preparation should be prepared according to the direction of the prescriber or as per methods given in the pharmacopoeia or formulary and are according to established pharmaceutical art of compounding. The compounded medicament should be filled in a suitable container with appropriate label depending upon the quantity and use. While delivering the prescription to the patient, the pharmacist should explain the mode of administration, direction for use and storage. Then sources of errors in prescription, abbreviation, name of the drug, strength of preparation, dosage form of the drug prescribed, dose, instructions to the patient, and incompatibilities. The first one, abbreviation. In most of the prescriptions, abbreviation terms are used by the prescriber that leads to major errors during interpretation by the pharmacist. The name of the drugs, names of the some drugs either looks or sound alike. So any error in the name of drug will lead to major danger to the patient. For example, altrocin, eltroxin, acidin and apidin, etc. Strength of preparation. Drugs are available in market in various strengths. So a drug must be not dispensed if the strength is not written in the prescription. For example, paracetamol tablet 500 mg should not be dispensed when no strength is mentioned in the prescription. Then dosage form of the drug prescribed. Many drugs are available in more than on dosage forms. For example, liquids, tablets, injections, or suppositories. The dosage form intended for the patient must be mentioned in the prescription to reduce ambiguity. Dose. It if unusually high or low dose mentioned in the prescription, then it must be consulted with the prescriber. Sometimes is a sustained release dosage form is prescribed twice or more times daily. Actually, sustained release dosage form should be given once or twice daily. Instructions to the patient. Sometimes the instruction for a certain preparation is either omitted or mentioned partially. The quantity of the drug to be taken, the frequency and timing of administration, and route of administration should be mentioned clearly so that it is easy for patients to take medicine. Then incompatibilities. It is essential to check that there is no pharmaceutical or therapeutic incompatibilities in the prescription. If more than two medicines are prescribed, then it is the duty of pharmacist to see whether their interactions will produce any harmful effect of patient or not. Certain drugs has interactions with food. The pharmacist has to advise the patient about it. For example, tetracycline should not be taken with milk or antacid. Then abbreviations used in prescriptions are included in this PPT. Thank you.